Imagine a critical window of opportunity, a time when a child's brain is just developing at its absolute fastest pace. It's laying down the very architecture for their future. Now, for children with autism spectrum disorder, or ASD, this window for early intervention, it isn't just important, it's absolutely vital. Yet, as we're about to unpack today, far too many children are, well, they're still missing out during this crucial period. Today, we're doing a deep dive into a really fascinating and incredibly important research article. It's from Autism Research by Daniel E. Lidstone, just published this year, 2025. And this study gets right to the heart of it. It zeroes in on the stark reality of whether children with ASD are actually getting the early intervention they so desperately need during those most critical early years.
Yeah, and what's really interesting here is how they did it. This research uses recent, solid national data. We're talking the 2021 to 2023 National Survey of Children's Health, and it carefully pinpoints specific factors linked to whether kids got into early intervention or EI specifically before they turned 2. So our mission today is really to pull out the key insights from this study. We want to help you understand the landscape right now, the challenges that persist, and, what really seems to make a difference in getting kids with ASD timely support.
Okay, so when we talk about ASD, that word early just keeps coming up. Can you break that down for us? Why is that specific timing so critical for development? What's happening in those first couple of years?
Well, it really comes down to brain development. Those first 2 years are just a period of explosive brain growth and plasticity. It's when the brain is most adaptable. So early intervention during this optimal window, basically birth to age 2, can really significantly improve developmental outcomes for children with ASD. We're actually talking about shaping fundamental brain pathways. And the research is pretty consistent on this. A later diagnosis, so say after 18 months, tends to be associated with more severe developmental delays later on. It really just hammers home the benefit of getting support in place as early as possible. You're leveraging that incredible period of rapid brain development to hopefully modify developmental trajectories for the better.
Right, harnessing that plasticity.
Mm.
So, okay, it's clear this early window is just paramount. But, if we know it's that important, how are we actually doing as a society? Are we leveraging this window effectively? What's the scale of this challenge?
That really is the crucial question, isn't it? If it's so vital, how well are we delivering? And to put it in perspective, ASD is one of the most common neurodevelopmental disorders here in the US. The estimate is around 1 in 36 children.
1 in 36.
Yeah, it's a significant number. That's a lot of families, a lot of children potentially needing this early support.
And this is where Lidstone's study delivers a finding that, honestly, it just really makes you pause. Despite knowing how vital early intervention is, the study found only 15% of preschool children with an ASD diagnosis had actually received EI services before they turned 2. 15%.
It is. It's a shocking number. And it's more than just surprising. It's like a flashing red light for our public health system. It really highlights the systemic barriers that are still in place. The 15% figure shows a critical gap, a huge disconnect between what we know works the benefits of EI and who's actually getting it during that most critical developmental time. It's a major public health challenge because the very children who stand to gain the most are overwhelmingly missing out.
That 15% figure is just, yeah, it's sobering. It really makes you ask, okay, if it's so critical and so few are getting in that early, what are the roadblocks? What is this maze, as you put it, that families have to navigate to get these services?
It absolutely can feel like a maze. The main framework, the federal one, is Part C of the Individuals with Disabilities Education Act, IDA Part C. That's the system for infants and toddlers, birth to age 3. So under Part C, kids can qualify in a couple of main ways. One is an early ASD diagnosis, usually meaning before 24 months. But importantly, many states also allow eligibility based on showing what's called significant developmental delays.
Okay, what does significant delay usually mean in this context?
It varies state by state, which is part of the complexity, but typically it means something like a 25 to 50% delay in one or more key areas. Think motor skills, adaptive skills like feeding or dressing, social emotional development, communication, or cognitive skills. And some states, though not all, also grant eligibility for certain diagnosed conditions that have a high probability of leading to future delays. Things like Down syndrome, deafness, blindness, or sometimes even low birth weight.
That varies widely by state, you said.
Widely, yeah, that creates this real patchwork of access across the country. So the process usually starts if a toddler is suspected of having a delay. Parents, or maybe their doctor, make a referral for an assessment. This assessment is done by what's called an Individual Family Service Plan team, the IFSP team. It's a multidisciplinary group. If the child is eligible, that team works with the family to create the IFSP. It's designed as a living document outlining specific goals for the child and family, and it gets reviewed and updated usually every 6 months. And the services themselves, they can look different. Sometimes it's a parent coaching model where therapists teach parents strategies to use daily. Other times it's direct therapy provided by professionals in the child's natural environment, like at home or daycare.
Okay, so it sounds like a child, maybe one who ends up getting an ASD diagnosis later, could easily miss out on Part CEI for a few key reasons. Maybe they just weren't referred or assessed at all in those first 2 years. That seems like a big hurdle.
A huge one, yes.
Or they were assessed, but maybe their delays weren't considered significant enough yet by their state-specific rules, or they didn't have one of those automatically qualifying conditions.
That definitely happens. Symptoms can emerge gradually.
And then I suppose even if a child is found eligible, the family might decline services. Maybe they're overwhelmed or don't understand the benefits, or perhaps there's still some stigma involved.
All of those are possibilities, unfortunately. It really underscores that getting services involves more than just the eligibility rules. It involves navigating the system and the family's own circumstances.
Right. So given all these hurdles, this complexity, what was this study trying to find out? What was the core question?
Basically, the study wanted to cut through all that complexity and figure out what are the strongest predictors? What factors actually increase the odds that a child does receive EI before age 2? So they looked at data from 478 preschool-aged kids. These were children who already had an ASD diagnosis, a documented developmental delay, and were receiving special education services later on. And they examined a whole range of factors, things like, when the ASD diagnosis happened, the family's socioeconomic status, race, how severe the ASD symptoms were reported to be, biological sex, birth weight, and other indicators present early in life.
And did they find some clear answers? Did specific factors really stand out?
They did. The analysis pointed to 3 factors that were statistically significant predictors of getting that timely intervention before age 2. These really highlight where the system connects for some kids.
Okay, let's break those down. What was the first one?
The first, and perhaps most intuitive one, was having an ASD diagnosis before age 2. Children diagnosed that early were found to be more than 3 times more likely to receive early intervention compared to those diagnosed later. This study reported an adjusted odds ratio, an AOR, of 3.25.
Okay, 3.25 AOR. So for other factors, that early diagnosis gives them over 3 times the odds of getting EI. That sounds powerful.
It is powerful, and this is a really important. But the study also found that only a tiny fraction, just 6.7%, of the preschoolers with ASD in their sample were actually diagnosed that early.
Wow, only 6.7%. So while it's a strong predictor, it only applies to a very small group in practice.
Precisely. It tells us early diagnosis matters for access, but it doesn't explain how most kids who might eventually get an ASD diagnosis are faring in those first 2 years.
Okay. What was the second key predictor?
The second was higher socioeconomic status, or SES. Children from families with higher incomes. The study defined this as over 200% of the federal poverty level were significantly more likely to participate in EI before age 2. Their AOR was 2.05. So essentially, they were about twice as likely to access those early services compared to children from lower-income families.
Twice as likely. That points to some real equity issues in access.
Absolutely. It suggests that navigating the system, or perhaps having the resources to seek out evaluations or manage appointments, is easier for families with more financial stability.
And the third predictor?
The third significant factor was low birth weight. Children born weighing less than 2,500 grams, which is about 5.5 pounds, were also significantly more likely to get early intervention. Their AOR was 2.03, so again, about twice as likely.
Interesting. Low birth weight itself being a predictor. You mentioned earlier some things didn't turn out to be significant predictors in this analysis.
That's right. In this particular data set and analysis, factors like race, they categorized it broadly as white versus non-white, and biological sex, male versus female, didn't show a statistically significant association with receiving EI before age 2. There were also a few things that showed what they called trend level significance. Things like having severe ASD symptoms reported by parents, or having other early indicators like Down syndrome, deafness, or blindness. These showed a potential link, but it didn't quite reach the standard threshold for statistical significance in this study.
Okay, so we have these 3 main predictors: diagnosis before 2, higher SES, and low birth weight. But what does this mean in the bigger picture? Why do these specific factors matter so much? What barriers do they reveal?
Well, if you step back and look at them together, they really do highlight some fundamental structural barriers in our current system. Let's take the diagnostic timeline first. As we said, ASD symptoms often emerge gradually. And standard screening practices like the MCHAT, often used in pediatrician offices, typically start around 18 months, sometimes 24 months. This means getting a formal ASD diagnosis before age 2 is frankly uncommon, which directly limits how many kids can qualify for EI based only on an ASD diagnosis that early. It strongly suggests that many of the kids who do get EI before 2 are probably qualifying because of other noticeable developmental delays like speech delays or motor delays rather than a specific very early ASD label.
So the system is maybe catching some kids early, but not necessarily because it identified their autism early.
Exactly. It points to the importance of looking at broader developmental milestones. Then you have the socioeconomic hurdles. We saw that higher income doubled the odds. Lower income families face real challenges. It's not just about affording services because Part C services are often free or low cost. It's about, navigating what can be a really complex system of referrals and evaluations. It's about having the flexibility with work to attend appointments, arranging childcare for other kids, transportation. And on top of that, there are documented workforce shortages in many areas for EI providers, which can make finding available services even harder, especially for families with fewer resources to advocate or travel further. These are practical, everyday barriers.
Yeah, those are very real-world challenges. And what about the low birth weight predictor? You mentioned something about state policies earlier.
Right. So while low birth weight clearly flags a child for higher developmental risk and was a predictor of receiving EI in the study, there's a policy disconnect. Only about 38% of states currently list low birth weight as a condition that automatically makes a child eligible for Part C services. And even in the study, remember, only 22% of the kids who had both ASD and low birth weight actually got EI before age 2.
Only 22%, even though they had that risk factor.
Exactly. It really points to a missed opportunity. If more states recognize low birth weight as a qualifying condition, that alone could potentially open the door to earlier support for a significant group of vulnerable infants.
So piecing this all together, the late typical diagnosis, the socioeconomic barriers, the policy gaps around risk factors like low birth weight, it paints a picture of why that 15% number is so low. Given these insights then, what are the takeaways for policy? What changes could actually move the needle and get more kids support during that critical window?
The research definitely points towards several potential avenues for improvement. One big one is rethinking the eligibility criteria for developmental delay itself. Perhaps broadening the definition or lowering the percentage delay required could allow more children with emerging concerns to qualify earlier, even without a formal diagnosis like ASD yet.
Making the delay criteria more sensitive.
Potentially, yes. Another clear policy lever is encouraging more states, perhaps through federal incentives or guidance, to add low birth weight as a direct qualifying condition for Part C EI. That seems like a relatively straightforward change that could have a real impact. And then, crucially, we need targeted strategies to reduce those practical barriers for disadvantaged families. What can states and providers do to make accessing and participating in EI easier for families facing socioeconomic challenges? That needs real focus.
Beyond eligibility and access, what else?
Well, there's the ongoing push to develop better, more effective, and maybe even more universal screening tools to detect ASD and general developmental delays even earlier than we currently do. If we could reliably screen effectively before 18 months, that could be a game changer. And finally, just improving the coordination and communication between primary care doctors who often see kids first and the EI programs, making that referral process smoother, clearer, less like a maze, could make a big difference for families.
That makes sense. Better teamwork across the system.
Exactly. But, we have to be realistic. The study suggests that getting significantly higher rates of EI participation before age 2, moving that 15% number way up, would likely require some pretty fundamental shifts. Shifts in how early and how universally we screen for ASD, and probably changes to the eligibility rules that go beyond what's currently common practice.
It sounds like incremental changes might help, but a major leap requires rethinking some core parts of the system.
That seems to be the implication, yes.
Now, as with any research, it's important to understand the limitations, right? What does this study not tell us, or where do we need to be cautious?
Absolutely. Good science acknowledges its boundaries. First, this study used cross-sectional data. That means it looked at a snapshot in time. It can show us associations like higher SES is associated with more EI, but it can't prove cause and effect. We can't say for sure that the higher SES caused the increased access, although it strongly suggests contributing factors.
Okay, association, not causation. What else?
Second, they focused on a specific set of conditions detectable around birth, like low birth weight or Down syndrome. They might have missed other early diagnosed conditions that could also influence whether a child gets into EI. Third, and this is a big one, the study didn't have data on the quality or the intensity or the specific type of intervention these children received, just whether they participated before age 2. Those details are really crucial for understanding long-term outcomes, but weren't part of this data set.
Right, just knowing if they got services doesn't tell us how effective those services were.
Precisely. Also, the data relied on parent reports for things like the timing of EI and the severity of ASD symptoms. There's always a potential for recall bias, parents misremembering exact dates or subjectivity in rating symptom severity. And the way race was categorized, just white versus non-white, is very broad. It could easily hide important differences in access or experience among various racial and ethnic groups within that non-white category.
That's a common limitation in survey data.
It is. And finally, as we discussed, eligibility rules for Part C vary so much state by state. That makes it tricky to draw perfectly uniform conclusions from national data because a child's experience really depends heavily on where they live.
Okay, so keeping those limitations in mind, what's the big takeaway here? This deep dive has really, I think, laid bare the complex reality of early intervention for kids with ASD. We've clearly seen that things like when a diagnosis happens, family income, even birth weight, these factors play a huge defining role in who actually gets support during that absolutely critical early developmental window.
That's right. The findings really underscore an urgent need. A need to refine our eligibility policies, maybe make them broader or more sensitive. A need to develop and implement even earlier, more effective screening tools. And threaded through all of that is the absolute necessity of ensuring equitable access, making sure that every child who could benefit from EI gets that chance, regardless of their family's income, where they live, or the specific circumstances they're born into.
It really brings home how much these large-scale, systemic factors, policy choices, economic realities, screening practices directly impact individual children's lives, especially our youngest and potentially most vulnerable. So as we wrap up, here's something to think about. What stands out to you most about this interplay we've discussed between getting an early diagnosis, having access to services, and the policies that shape both? How might we as a society truly do better in supporting these critical early years for all children, ensuring that this vital window of opportunity isn't a door that's closed for so many?